Hi, Dr. Awashi. I want to take this moment and thank you so much for doing my knee. It is so awesome to be able to walk straight and not bump into everything. You also sit there and did my wrist when I broke it 3 years ago almost. So thank you. I'm glad that God gave you the ability and the talent and the funds to do this. You are an awesome doctor, and I tell everybody about you. All right, God bless.
Thank you for that. This is an appreciation event where really it just thanks you, the patients, for putting your trust in our physicians and putting the trust in our group. And really it's just a thank you to you. We try and have these every single year. When we had COVID, it kind of killed, functioning. So it was fun doing our very first one, and this is now our third. And it's a nice place. We were at the golf course for the very first one, but it was very cramped. And so we kind of here for the second one and then for the third one. And as we keep doing these every year, it's just a thank you to you and it's a scary thing. My mother-in-law has had both her hips replaced. And the very first doctor we took her to, I said, you are not going back to that person. And just the demeanor of the physician and the way he acted, I knew that wasn't going to be a good outcome. And I know it can be kind of scary as a patient has to have some sort of major procedure. You want to be in good hands. And that's one of the reasons why we kind of put this event together. We just want to reiterate the hands that you put us in are good providers. I'm the Chief Executive Officer. I've been with AVORS for about 5 years. I will tell you that I've worked with some of the best providers in the entire Antelope Valley. And on top of that, we have the best staff in the Antelope Valley. People who are here today just supporting us, Yesenia Huerta is our Chief Operating Officer, we have Adam, our CFO, and we have a few other key people like Vivian. If I could just have you stand for a second. I'm going to embarrass you, sorry. Stand up. Everybody look at them. And if I can also just give you guys a round of applause. Does that work? And we'll go ahead and just get started, but the people who are here today in the room are some of our vendors that we use. DePuy is Johnson & Johnson. Some of you may have their hip in you. They have a very, very good hip implant that our providers love. There's a big change. So when I was a teenager, Stryker was really the only total joint that was there for the knee and the hip. And I think one of the things you always heard as you got a knee replacement or hip replacement was don't be too active. And as someone getting a knee or hip replacement, that's probably not what you want to hear, right? But one of the things that have changed in the last 30 years since I was a kid was the issue that you ran into was also with the microplastics. So the more you exercise, the more plastic sheared off of the instruments or of the metal, and that has been a thing of the past. So what we like to do is you can be very active with a hip replacement and still be mobile and not lose mobility, which is great. And we really love them as a vendor. Biotronic is a spinal stimulator that is amazing. So previously we had used some others. We've really been using the Biotronic because not only does it help you against pain and reduce your narcotics, it really actually has this cool feature inside where you can do remote monitoring. So as patients who have really bad pain, we can actually program the setting to be very specific to reduce that pain. And it's revolutionary, it doesn't exist anywhere else, it's an amazing technology. We have the Palms Home Care and ProMed, as well as we have the bone cement in the very back. And I just wanted to thank them for being here. It takes a lot out of your day to drive to listen to a bunch of people talk. And again, we've been writing all new jokes to hopefully entertain you while we're here. I would like to give a shout out to Dr. Sherfey. He had the best joke I've heard in any one of our presentations last year. Dr. Sherfey had himself some shoulder surgery, and Dr. Alon Antebi is the one who performed it. So he got on stage and said, "My surgery's been great." It was one of the best jokes. It was so convincing that he had to go, "I can do it, I swear I can do it." So it was one of the best jokes I thought. So thank you for that. Originally we were going to have Dr. Antebi speaking. Unfortunately, due to surgery and things, he couldn't be here today, so he's off saving someone's arm or leg. So I wanted to just let him know that he wouldn't be able to be here today. But we have two of our really good physicians, Dr. Nasser and Dr. Sherfey will be talking today. So unfortunately, I don't think the sound is going to work, but this was a presentation on the John Sally podcast. He's a famous basketball player. I'm going to try and do this, but the moment it fails, just in mind, I'm just going to turn it off. It's hard to do two things at once, so I have it queued up here. I'm going to try and play it while it goes on here in the exact same spot, so let's see if this works. Oh, it's not working. Okay, so John Sally on the podcast, Dr. Thomas Nasser, Dr. Joseph Sherfey, and Dr. Alon Antebi, they went and presented. And it was really interesting because John Sally got up and said, you know, I've been to many physicians' offices, and I've never seen one do an event like what we do. He was here for the last one, and he just was saying that is such a cool thing. And it's also, if you go to the providers' web pages, under Dr. Antebi, Dr. Sherfey, and Dr. Nasser, if you scroll down and see the podcast, you can watch it. It was just cool. It's something he'd never seen before, and he thought like how forward-thinking it is as a physician to kind of include the patients and have a thank you to them. Everyone always asks me, what does AVORS stand for? And you think we would have had something maybe a little catchier, but right there is Antelope Valley Orthopedic and Rehabilitation Specialist. It's a cool fusion of, at the time it was rehab and pain management combined with orthopedics. And it was a fun little spin because one of the scary things for an orthopedic surgeon is patients who sometimes need higher quality pain management. So as AVORS was created, it was a way to solve that problem that really plays a lot of other orthopedic groups. And we do, like getting a little kid in there with the hat, we do pediatrics as well. So lots of kids who've been riding their bikes in front of cars, or kids who fall and break their arms, or adults. We had an adult, oh my goodness, who's putting his Christmas lights up with a ladder with anyone helping him. And the typical video you watch on YouTube where he had no support on the ladder, so as he got high, the ladder fell and he fractured his hips. We are the ones who put Humpty Dumpty back together again. And it's a great fusion of pediatrics with adult care that we strive for, founded in 2005. So we are the leaders in musculoskeletal care. So you have Dr. Alon Antebi, he is board certified trauma. You have Dr. Joseph Hurley, he's board certified. He's the one on the right. I know he's speaking to you today. We call him the shoulder whisperer because in the orthopedics and the certification, he does a lot of shoulders in the Antelope Valley. Next to him is Dr. Orlando Pena. He is pain management and physical medicine and rehab. And that's me. Dr. Hopkins, he is our trauma foot and ankle physician. Next to him is Dr. Tennant. He is again another trauma doctor. He's trauma fellowship trained. To the left of him is Dr. Justin Heller, who is hand, elbow, and upper extremity, as well as a plastic surgeon. Underneath him is Ramon. He's one of our nurse practitioners. He goes to all the nursing homes. We are the only pain management group that has a comprehensive program where we visit the hospitals, the nursing homes, and we have a clinic. So for patients who get really injured, they can't control their pain at Palmdale Regional and Antelope Valley Hospital, they consult us. For nursing homes, the 4 main ones here who have uncontrollable pain, we do consultations there as well as we go to our clinic. And Dr. Thomas Nasser is to the right of Ramon, and then Dr. Eric Wash is on the far right. We do a lot, we're trauma. So a lot of what we do is musculoskeletal trauma, and then we do the total joints. What's been a cool feature with the different things we offer is we can take care of your musculoskeletal issues from your head to your toes. So a lot of these pictures that we have here, like with the child, as well as with these pictures, this is everything we do. We do any pain you have, any total joint reconstruction, back pain, you hurt your elbow, you play a lot of tennis, you get hurt, you play a lot of golf, we can get you back to your sports. We do like the foot and ankle trauma, we do everything. We have a DME suite where we can get you even hospital beds, we can do everything related to durable medical equipment, and then we have digital x-ray imaging. So one of the coolest things ever is last year in every category we won AVORS Best. So we won AVORS Best Foot and Ankle for pain management, for ortho, for plastics, we have Dr. Tony Smith, he's a chiropractor, and he's AVORS Best Chiropractor year after year after year. So it's kind of fun in all of our categories to win. Oh, thank you. What I love the most is the AVORS Best is won by you guys, not by us. So it just means that people trust who we are. I love the picture. Look how dreamy they are. Great. Those are our 4 owners of AVORS Medical Group. We've now expanded it with our ownership. This is Dr. Eric This is the best one. I just love that there's blood everywhere. Again, as we're having, and he just does a picture. This is a total knee operation. I took a quick picture. This patient went from not being able to bend his knee and have zero mobility to being able to fully extend his knee and go back to running and jogging. So again, this is the benefits of what's changed in the total joints. Is it used to be minimal activity to this person can now do marathons. This is Dr. Alon Antebi. He was doing on the left picture. He was doing a implant, and so he took out a bit of tendon, had to flex the tendon out and put it back in the person's arm so they could have full mobility of their arm again. So on the top left is Dr. Hopkins, on the right is Dr. Tennant, and then on the left, the two surrounding faces under their masks is Dr. Penny and Dr. Thomas Nasser. One of the coolest things, we are the only medical group in the Antelope Valley with over 1,400 5-stars. Most of the different clinics have tons of 1-stars where their 1s and 5s play tennis. Ours do not. So we're the only medical group that has over 1,400 5-stars. And I love the feedback that our patients give us. They give us a lot of feedback. One of the things I like to point out too as well is in this slide, this is when we did the first anterior hip approach. I called all our major hospitals last month to ask some questions. We are the only physicians in 150 miles who do over 250 anterior hips a year. So in over 150 miles with different Providence, there's Providence that's in, okay, so the Providence in, it's Mission Hills, but there's another one in Burbank. So there's a big Providence in Burbank, there's Mission Hills, there's everywhere in Tehachapi, there's everywhere in all around 150 miles, and we do more total joints than any other surgeon combined. So that's one of the, and here's the kicker on that. We also do 20% of our total joints are fixing other people's mistakes. So that's one of the things that we like. We are the top ranked for every category that we have. So all of our total hips, total shoulder, total knee, we're the top ranked. We're also the top ranked for pain management. So Dr. Thomas Nasser is going to talk a lot about the procedures he does a little bit later, but we're the number one ranked for all of those special procedures. And we offered a brand new one called an Intercept. Right now we're getting over 100% yield on the results, so it's very, very good, no pressure on that. We were mentioned last year in Providence in summer, and they took the same article and just slapped it on for January. But we were the article for our total joints and anterior hip approach. We'll talk a little bit about that later. I wanted to take one review and just talk about it. This is for Dr. Thomas Nasser. As I was going through and just picking some of the reviews to talk about, I was struck at the one that said, "I am me again." So that's one of the coolest things for those of you who unfortunately needed a pain management provider. And then the next one what made me laugh a lot about Dr. Sherfey is he had so many reviews that said, "That doctor is Sherftastic," or "Sherferific," or just review after review that said that, so I laughed at it. But I like this one. I just want to point out, Dr. Sherfey, that they said your role, not me. But they said Dr. Sherfey's old school bedside manner made me be more confident. One of the things that kind of struck me as I started here, I came from Alaska. I was CEO of a Center of Excellence. And what that means is the best outcomes, Blue Cross and Blue Shield as the two payers, they go out in an entire state and they say, this person has the highest quality, so we're going to make sure that we direct all the patients there. So in that model, we did total joints, we did lots of hips, but we did the posterior approach. So what that means is you're cutting through muscle, you're cutting through a lot of things that make your recovery really painful. Now for those of you who've had a hip replacement, can you raise your hand? So as a lot of you, who had the anterior approach in your hip replacement? A lot of you know, and this is what I didn't know at the time, thank you. When I came here, my very first day, I walked out of into our surgery center, and a patient left who just had surgery 3 hours before. So if you have the posterior hip replacement, your So I came from a center of excellence that couldn't deliver results like that. And that has blown me away with how well these different techniques and approaches that providers have to healthcare. We're going to talk with two of our doctors. The first who's going to come up here is Dr. Joseph Sherfey. Some of the cool things to talk about him is he's fellowship trained in lower extremity reconstruction and orthopedic. What that means is his fellowship, after he finished his normal medical schooling, helped give him superior training when it comes to total joints. Why the fellowship is so important is a lot of times providers will leave, get their medical degree, which is great, but when you have a fellowship, it means you're spending extra time and training to be very specifically trained in whatever they're doing. A fellowship is a world of a difference when it comes to if you're having a provider, because it just means the time and training is more specialized. That's what you want. You want someone who's had more specialized training. What's also pretty neat is most of our physicians are DOs. And a lot of you might ask, what is the difference between an MD and a DO? Well, a doctor of osteopathic, which is a DO, is more trained in musculoskeletal. So one of the things that you want is you want someone who's an ortho who's had specific musculoskeletal training that an MD doesn't have. So that's what his degree is. He also was the first doctor in Canada to be trained as a DO and recognized by the Royal College of Surgeons and Physicians. So when I read that, I said, first doctor. I'm like, wow, he's old. That's the first DO in Canada, a trendsetter. Again, he's an amazing orthopedic surgeon and an amazing person. And he's also the medical director for Palmetto Regional for their Orthopedics and their total joint program, as well as the co-medical director of Embassy Surgery Center. Embassy Surgery Center is on our 3rd floor, and it is the only center of excellence when it comes to outpatient surgery in that ambulatory surgery center. So what we'll do, I'll get him set up and I'll set up.
Buenos días, mi nombre es María Delgado y estoy aquí para dar las gracias a Dios antes que todo y al doctor Antebi y el doctor Nasser, porque el doctor Antebi me ha operado mis 2 rodillas y quedé bien. También el doctor Nasser me hizo una operación en la espalda para ponerme un estimulador para calmar mis dolores de la columna. Y todo esto, pues se lo debo a ellos después de Dios, porque ahora me siento bien, camino bien y ya no tengo dolores en las rodillas. Gracias.
So, welcome and good morning. Thank you for coming. So first, this little button. First thing I want to do is just actually thank you guys. That's what this event is about. I mean, we created this to take time to thank you for choosing us, okay? You guys have a lot of physicians, not only locally, but in the Southern California area, that you guys can choose to go to. And you guys put your trust in us and the providers at AVORS. And I just want to take a minute and give you guys a hand, because we really appreciate that. So it is amazing, and this is what impressed John Sally when he was fortunate enough to attend last year, is that a lot of healthcare systems and a lot of healthcare providers, I don't think, take the time to actually thank you for, trusting in them with yourself. And it does, I think, make our community here unique, that we do want to appreciate you guys, and that we hope that we have done everything in our power to serve you in the best way we can. Medicine is an art, and it has ups and downs. And as many of you know, sometimes you'll have a great outcome, and sometimes you don't have a great outcome. But we hope that regardless of what you're experiencing, that you've experienced at least some compassion and some care and some attention from us, because that's what we really strive to give you. And again, we want you to just be recognized, we want you to be appreciated, and we want you to know that we are here to continue to serve and take care of you, your family, and everybody else in this community. So I just can't honestly thank you enough, and that's why we do this event. And so hopefully we'll continue this year after year after year. We've seen this grow this last 3 years that we've done it from, I think we had, 40, 50 the first year, to talk's only about 2.5 hours long. I want to leave about 5 minutes for Dr. Nasser because he will otherwise talk forever. So we're going to cap that down today. But I want to first thank our vendors that you guys have seen around the room. They help sponsor this event. They also help support us with what we do to take care of you. And so it's very much appreciated. So take time to go meet with them, to go see what products they offer. You will see some really cool stuff. Many of you actually have these implants in you from DePuy. We have some other vendors that you guys have implants in from Max Freedom. They're representing their bone cement today, but a lot of you guys have their hips or knees in as well. So, I mean, these are the people that we use. A lot of people will have this stimulator in that they're here representing. There's some home health care agencies here that have taken care of you after your procedure. We brought in the robot here. This is something that some of our doctors in this community are passionate about trying to get here to this community and bring, and they will show you what that entails and what's it all about. So again, we appreciate them sponsoring and do take time to go look at what they have, ask questions. I mean, they're here for you, and they're the stuff that we use. I also want to take a minute to thank Midian and her team that helped put this together. So I know she's already had to stand and appreciate her. I won't put her through that again, but thank you. You did a great job, and I hope everybody enjoys your hard work. Thank you very much. Let's see. I'm going to talk a little about today. Last year I talked about shoulders and kind of some of the new stuff and what we're doing in shoulders. But I wanted to take this time to do a little bit, kind of what Joseph touched on. And I want to call this just getting to know AVORS, okay? I want to share some of the things that you guys may not know about some of the doctors or some of what we offer here. And I think that it's pretty unique in this community that we are trying to grow and develop into kind of a one-stop shop for everything that you guys need. And so I want to touch on some of that because, again, you guys may have interacted with just a little bit of our staff or just one physician and maybe don't know everything else we have. I know Joseph kind of went through a little bit, tried to introduce some faces. So I just want to spend a few minutes, again, to kind of basically brag on my partners and brag on the other people that we have here in this community. Because I think that they're wonderful people. I think they're wonderful surgeons and providers and physicians. And I just would hate for you to miss out if you have a need or are looking for someone to miss out on some of the other things that we have. So let's touch on the providers first. And in no way did I receive any pay or compensation for bragging up any of them, just so you guys know. So I'm going to start with our physical medicine and rehab doctors. These are affectionately known to most of you guys as our paying doctors, okay? Because anybody that us as orthopedic surgeons don't want to deal with anymore, we send you to them. I'm just kidding. We actually want you to be well taken care of. An injury or a surgery can be a painful thing. Some of you guys have to live with something that's happened years ago and it's never going to get better, and you need somehow to help manage this, and these are the people who do it. And they're some of the best, not only in this community, they're some of the best, honestly, in the state and even nationally. I started my medical career, I've been all over. I trained in Michigan, I did stuff in Boston and Florida, I then went and did a fellowship in Canada, and then started my practice in Seattle. So I can confidently tell you that around our nation, you actually have some of the best providers that you will meet. And one of them is Dr. Nasser. He does things in the realm of physical medicine and rehab that no other physician does. You will see doctors that just will manage your pain, and they will give you medications, and they will manage that. You will see some that will use some modalities like injections and other things to help control different situations. Dr. Nasser does all that, but he also does multiple other procedures. Too long for me to list, and I think he's going to touch on some of what he does. But he truly is, can offer everything to take care of you. And he does procedures, he does things in the hospital, he does things at so, I just want to brag him up a little bit for that. In addition, I'm going to talk about Dr. Pinya. He joined us a few years ago, and again, a wonderful physician. He actually speaks fluent Spanish, so you guys, you don't need to listen to my Spanish. He speaks fluent Spanish. He is a local boy. I think if I don't get me wrong, you remember what high school he played football at? Was it in Santa Clarita or in Palmdale? St. Santa Clarita. But he's a local boy. He grew up in this area. His family's from this area, and he returned home to come care for his community. An amazing person. He does a lot of what Dr. Nasser does. He's actually a specialist in what we call a nerve conduction or an EMG study. So if we send you to him, he'll be the one that pokes all those little needles in you to test your nerves, okay? So remember that face, because you won't like that at all. One of our newest members is Dr. Daniels, who many of you may not have got to meet him yet. He just started a few months ago. He is from the California area, but trained in Miami, and he brings a lot of expertise from his fellowship. He's new. He is going to do all the things that Dr. Nasser is going to do. He's kind of taking him under his wing and helping mentor him up. Great physician, great person. You'll love him if you get seen by him. Ramon, again, Joseph touched on him. He's our nurse practitioner. Ramon gets the glorious job of having to go to all the care facilities in the community. So if you have to go, either if you reside there or if you have to go there to recover from an injury and you're at one of our nursing or care facilities in this community, Ramon can see you there and he will help manage your pain. He will help manage your rehab. He speaks and works directly with the other 3 doctors, and they come up with a care plan for you, and it helps also you tie into our practice to follow up later. So, wonderful person, and he can come to you where you're at, which is a great thing. Next, we have the orthopedic department. This is probably the best department that ever existed. Not that I'm part of it, I didn't even put my picture up there because I'm in front of you. So, but we have great orthopedic surgeons. Okay, Dr. Antebi, many of you are patients of his. He and Dr. Nasser are the ones that originally started this practice years ago. He's the trauma director at Antelope Valley Hospital and at Providence Hospital in Mission Hills. He's one of the guys that, if unfortunately you come into the emergency room and you have something broken, you will probably see him. He's a wonderful surgeon, great experience. I trusted him enough to let him operate on me, and I'm doing better than last year, as you guys have seen. So, great surgeon. Next is Dr. Greg Tennant. Dr. Greg Tennant joined us a few years ago. He actually trained at Vanderbilt University. That's where he did his trauma fellowship. Like Dr. Antebi, he's a trauma specialist. They do other cases. They do total joints. They do other things as well. I'm just kind of giving you some of their highlights. He actually created and founded the Kaiser trauma program, I believe in Kaiser Fontana. Developed that, grew that over about 10 plus years, and made it one of their premier trauma programs in the Kaiser system. Luckily, Dr. Antebi and myself knew Dr. Tennant from our internship in Michigan, and so we convinced him to leave the Kaiser system and come join us a few years ago. And so he's a great asset, a great person. He loves this community so much that he actually commutes every day from Newport Beach to work. So, we keep trying to convince him to move up here, but apparently a lot of us have this other person called a wife that will not leave Newport Beach right now. I think it's mainly the kids. The kids are keeping him there, but he does. He comes up, and so you'll see him if you come to the hospital and have to get taken care of from an injury. He's there, as well as in the office in the clinic. Around the same time that we brought him in, we brought in Dr. Washi. That's great. Hey, I was up here first. No, he's great. Dr. Washi, he did his fellowship down in Scripps in San Diego in total joint replacements. So he is one of our experts in total joints. I'm fellowship trained in total joints as well, but now that I'm getting tired from doing this job so long, I try to give a lot of my patients to Dr. Washi. I try to give everybody who's going to be difficult or He's very talented. He's also one of the big advocates of using this robot, and so he is trying his best to get that in this community. We keep trying to stop him because we don't want him to look better than us, but he is trying hard to bring that in. But he's very good, and you may get to see him for total joint replacements. Next we have a couple docs who are coming up. They get their own slide. That's because we think they're that special. So next is Dr. Justin Heller. He is our hand and upper extremity surgeon. He will take care of a lot of our complex hand injuries, injuries to your arm, if they get more severe. But he's also a fabulous plastic surgeon. He does plastic surgery with us on the trauma or the side when you need a skin graft or something to cover a wound. But he has his own practice that he does in conjunction. We call it his side hustle, where he does his kind of true like cosmetic plastic practice. He has offices here as well as in Valencia, and then I think he opened one actually in Santa Barbara or something as well recently. So a great surgeon, a great doctor. He, like I said, we will send him to most of our hand and upper extremity things as they get complex. Next we have our podiatry department is Dr. Kyle Hopkins. He came to us a few years ago. We stole him from another practice that was based more in the Burbank area, and we had heard good things about him and got him to come out our way. So Dr. Hopkins, he's amazing. He's our only podiatrist in the group currently. We're trying to get him some help. But he is basically on call every day, all year long. Okay? So when you go into the hospital and you have something with your foot, your ankle, a lot of people in this community have diabetes and they have bad, infections or stuff in their feet, and he has to go deal with that 24/7, the whole year long. So we really appreciate that. He started what we call the limb salvage program based out of Palmdale Hospital, meaning Antelope Valley had a higher rate of amputations in your lower extremities due to complex things from diabetes or vascular or circulatory problems. And we were above the national average. And so Dr. Hopkins took it upon himself to start this program, working with other physicians at the hospital, to try to basically save your legs. And he is making big improvements in how we care for people with diabetes and vascular disease. And we're trending now to be in a better position with this community that doesn't have that high risk of losing your limb. So fantastic job. We're glad to have him. Hopefully we'll give him a day off one day, but not yet. Next we have Dr. Tony Smith. Many of you have seen him in our office. He's our chiropractor, but he also has a strong focus in sports medicine. He takes care of a lot of the local athletes and teams around here. Tony is a great guy, one of the most experienced chiropractors in this area, and actually one of the most well-liked. He wins AV's best year after year after year. He does a great job because his goal is to get you better, not just to keep returning for additional treatments. And I think that is always a great key. Our goal is to get you back to independence and not have to see us all the time. But he's a great part of our team. One other thing I'm moving on to the next little section I should say is, many of you know, and some of you don't, that AVORS also is a partner with a family practice called Family First. So this had been around for about 10 years now. We went through a major transition over this last year where we had one of our senior partners decide to do something else, and she went on, and she was a very well-loved physician. And then this created some transition in our family practice. So I know this affected a lot of you who use them as our primary care providers. So just to give you some updates and news of what currently is happening with this is we are rebuilding, we are bringing in new physicians to kind of resume a primary care role. As a temporary measure currently, though, we are still functioning with them. These are our two providers, Narita and Simerjeet, who are seeing patients there. We're acting currently in an urgent care in a walk-in setting. And what does that mean? That means you can still come in and have your primary care or your issues taken care of or evaluated, but they do it more of a walk-in type basic or same-day type appointment. In addition, they are treating like urgent care needs. We're acting as a functioning urgent care with extended hours and extended both options to get seen in with and without insurance for cough, colds, or emergency things that don't have to go to the emergency room. So, keep that in mind that these services are still available for you. A couple real exciting things that we're now doing because this transition kind of let us look and rebuild and add things that we hadn't added before. We are now starting a program of some diabetic care. We're going to offer some different events and different things where you can come in and get, instruction, counseling, medications, and guidance to help manage and control your diabetes. Simerjeet is an expert in endocrinology, and his specialty is diabetes and diabetic care. And so we're really trying to promote that and utilize that now and help him grow ability to care for you that have diabetes. In addition, we're doing other programs such as medical weight loss and osteoporosis treatment. We're starting different programs where you can come in, you can get diagnosed with osteoporosis, and then you can get appropriate treatments. A lot of you have been seen, and you'll maybe have a DEXA scan or something else done with that, but you don't know what to do with that. So now we have a place where you can go, get guidance, get treatment, get recommendations. Same on the weight loss front. Weight loss is a big topic now. You see all the new drugs that have come out, all the new clinics that are opening. So again, people are interested in that. It's been very effective. But you should have guidance by a physician or guidance by a healthcare provider, and we're providing that. So just something to be aware that we do have this, and it is still functioning, and it's still growing, and we hope to have it back to its original and full capacity in a short time frame. Also, Joseph touched on Embassy Surgery Center. That is on our 3rd floor of our building, and many of you have actually had your surgeries there. It's a great facility, state-of-the-art. It's one of the best surgical facilities in the whole Southern California area. We get exceptional marks on our ratings and our scores for complications, patient satisfaction, etc. Just so you guys know, just to give you a little insight, an average hospital, an average busy hospital, does about 400 cases, 450 cases a month. Embassy Surgery Center last month did 630 cases. So we are busier at our surgery center than most hospitals in this whole Southern California area. And I think it just goes to show the amazing staff, the amazing leadership we have up there, and that we are trying to provide some of the best care and facilities that you guys can get anywhere around. So we're very happy with this. Lots we're improving. We're bringing in new lines. We have the GI doctor that goes there now. We're bringing in neurology that works there. We're bringing an OBGYN that works there. So many of you will probably have more and more things done at this center, and we're excited to take care of you. I want to take a quick second here. I only have a few more slides to go. We're almost done. So to thank our staff. You guys have experienced our office. You guys know the chaos that our office can be. You guys know how busy we are there as we try to take the best care of you we can. And our staff is amazing. We could not do it without them. We have over 150 people that work for us. And so all of them touch your lives and affect what you do. And we try our hardest to give them the tools to take good care of you. And they're just wonderful people. I can't thank them enough. You've met a little bit of them. I'm not going to introduce all of them because I'll forget someone and then I'll get yelled at on Monday, or I won't think someone I should. But you've met Joseph, our CEO. We have our CFO, Adam, here. We have our COO, Yesenia, here, and a bunch of our other staff, some of our surgery schedulers and other people you've talked to on the phone and seen when you've interacted. And we are very thankful for them. We could not do without them. I am going to give a special little shout out, though, just to publicly acknowledge a young woman who started around the same time I came here, been here a little over 10 years. She started on the floor as what we call a medical assistant, meaning one of the people who just put you in the room, takes your vitals, and does everything like that. And she excelled and was loved by the staff and patients, so we kept saying, hey, maybe she can do a little more, maybe she can do a little more. And so we kept promoting her into little positions, other little things, a little lead at the floor. Then she became the back office lead. And she's worked her way up to our newest COO, Yesenia. So important to just acknowledge some people that we call homegrown. I mean, to have someone who is from this community, started at literally the entry point in our organization, and is now tells me what to do every day. So she's amazing, and I think she's a little pit bull, and I love that she can do that. And so we are all scared of her now because we've given her so much power. Just to end up, I want to share a couple things that you guys may not know about AVORS and what we do. You guys know us as physicians, you know us as healthcare providers, you know what we do for you directly, but maybe you don't know what we do in the community. We have an extraordinary amount of community outreach, and we love to be involved in multiple ways. I'm only going to highlight just a few, but there's so much more to touch on. We are actively involved with sports medicine. We cover multiple teams. We have a partnership with Antelope Valley College that we cover the majority of their sports team. We're on the sideline for football games. When we see most of their athletes come into our office, we sponsor different events for them. And so this is just one of the teams. We have some other interactions with many of the other sports teams in the area. Last year, Dr. Antebi got us involved, and you guys may have seen or participated in what's called Hope Fest. It was a big event in Lancaster, brought celebrities, brought people from all over Southern California, and we were one of the major players in that event. In addition, we have partnered with local charities in this area. One of them is Grace Resources. We partnered with them for a number of years. We provide food drives, different things to help with different events they have. I think, what was the record we had for food? No, I think one of our records was like 3,000 pounds of food we delivered one year in one of our food drives. It's not something they've never had ever in their life. And thank you guys, because a lot of times you guys are contributing to that because we have donating bins in our lobby and around the offices, and so we appreciate that. But we love to partner with our local community. We have a toy drive that we're doing coming up here in mid-December, and currently I think we have something over 200 families that have reached out to they're going to bring their children to our office. We actually are, going to hand out treats and toys and do other stuff in that. And so, I mean, the list goes on and on, but we're very active in this community. We're also active in the world. We had a recent mission trip where we took part of our team down to Mexico, down to the Baja area, to an underserved area there where we provided medical care to the handicapped people in this area that don't tend to receive good care. We did local different procedures and wellness checks, brought a team. We also kind of adopted a family with an organization down there, and we actually built them a house. And you can see here, we got Joseph there carrying a bag of cement. So, I mean, he actually can do a lot of work. But we helped this family is the one on the lower left that had some small children, and they had this land but no house, and they were living in this like cardboard thing, and so we were able to build them that house in the background. And we did this all in just about a week's time. It was a fantastic trip, fantastic adventure. And again, I think it just shows the heart of what we are really about. We are about serving you guys as the community and patients here, but we're also about helping and serving people not only locally but all over the world. And I want to just close that with just reminding you guys, you'll hear a lot. When I first came to the Antelope Valley, I heard it a lot, that you have to leave the Antelope Valley to get good care and get good service. And I just want to say, I hope that I've given you a little glimpse into what we are building, what we are growing, and what we are offering, that you guys realize that just staying home, you can get great providers and great service here in our communities. So again, thank you guys. Thank you for being our patients. Thank you for choosing us. And with that, I'm going to bring up Dr. Nasser to say a few words.
Good morning. My name is Gail Harris, and Dr. Antebi is my doctor, and he's been great. He performed a knee replacement on my right knee in November 2022. I was afraid. I kept putting it off. He was very patient. He didn't push me into the surgery. He says, Gail, when you're ready, you come to see me. So I just want to thank Dr. Antebi for performing my right knee surgery, looking forward to the left knee surgery, and he was great from the beginning to the end. Thank you, Dr. Antebi.
A lot of times, there are people who are fellowship trained, and there are people who do the fellowship training. And one of the coolest things is Dr. Nasser trains people nationwide. So he has people who come from all over our nation as well as the world to get trained by him on the different procedures that he performs. And one of the neatest procedure that he performs, there's an example, it's called the Vertiflex. It's a little flexible piece of technology, titanium, that goes in your back, and it basically helps you against spinal stenosis. I had a patient who was hunched over so bad that he couldn't stand up straight. And one of the coolest things that I got to see with the work that Dr. Nasser does is this guy came in, he was hunched over with a cane, and unfortunately he was here last year, but he moved out of, still doing great, he moved out of state. But after his procedure, and when he was leaving, usually we wheeled him out with a wheelchair. But because he walked so much, he begged and pleaded, and so we let him stand. And so I remember him leaving, he's had 30 years of being, not 30 years, but 15 years of being crippled by this injury at work. And I got to see him stand straight up and walk out. And that's something he'd never been able to do since he got injured. And what was funny was I asked him to his face, I said, anything different? Because I noticed he was standing up straight. And he went from walking hunched with a cane to standing up and saying, no, I'm feeling different, as he's walking straight. So that was one of the funniest things that I got to see. And I was like, are you serious? And he's like, whoa, he just was shocked. And he's like, because he thought he was expecting himself to be hunched over. We talk a lot about Dr. Nasser as the heart and soul of our clinic. So he started the clinic now 19 years ago. And it's been interesting to see what he's been able to do. A lot of our longevity and why we keep moving forward is we have, Dr. Sherfey, yes, who provides a mission and pushes us forward. But a lot of the things that we've been able to do with the surgery center and the different modalities that we bring in our modalities because of the passion that Dr. Nasser brings. The ideas and the desire to push himself. I've never seen another physician who has the intensity and drive as Dr. Nasser does. And that's been one of the differences that I can say is I was a CEO of a group of 98 providers, and I feel like the group that I have here at AVORS is the best medical group that I've had the pleasure of being the leader of. I have providers who do things and spend so much of their time and energy on the community than they do themselves. The food drive, we don't even talk about the stuff we do in the community. The food drive, we provided 3,000 individual items. We provided 11,000 pounds total of food last year. And do we advertise it? We just do the work and hope that helps people. And that sums up Dr. Thomas Nasser. Instead of bragging about who he is as a provider, he instead does the work and lets it speak for himself. So let me introduce him.
Okay, so they took all my jokes. I don't really know what else to say. I mean, Dr. Sherfey did an amazing job, and Joseph is always so wonderful. And I'm sitting there thinking, like, wow, God, I was going to say that. I was going to say that. So I'll try to be a little bit more interesting and less long-winded than Dr. Sherfey. See how I do? I'm not always successful at that. So, do you guys know what the number one fear among Americans is? If you know, don't answer because it'll ruin the joke. It's not earthquakes, it's not spiders, it's not election results, it's not getting a joint replacement. It's public speaking, and my partners every year ask me to speak at pretty much every event that we have. So I'm starting to get a little bit used to their abuse. We'll see how it goes. So, like Dr. Sherfey said, we're here primarily to thank you guys. We are a very blessed group of physicians and administrators. I still can't believe that I'm allowed to operate on people, that they actually let me do it. It never stops getting weird to cut a person's skin or put a needle inside somebody's spine. And I think that kind of speaks to who we are and how we function. We really take it seriously. Last year, I started with this joke about how bad it was to wait in our waiting room and how long patients must be waiting for me. And so this year, I'll tell you a little something. So I saw my personal physician recently, and I need an MRI. And so he's my friend, and we had text messages back and forth, and I said, hey, are you going to order the MRI? Sure, no problem, I'll order the MRI. The MRI doesn't get ordered. So then I sent him an email. Hey man, are you going to order that MRI? MRI doesn't get ordered. So then I called his office. Hey, I'm Tom Nasser, and Dr. So-and-so is my doctor. He's supposed to order my MRI. Doesn't order the MRI. So I call the person who can do anything in the world, who's sitting at Huerta, and I say, can you please call this doctor and get my MRI? And what did I say to her? I feel like an AVORS patient. I can't get anything done. So we feel your pain, at least I feel your pain, and I know what that's like to be a patient. And one of the reasons why, we're here today is to let you know that we're not just physicians, we are people, we are patients. I don't know what slide I have next. So I'm going to try to answer a couple questions. If I mess up on these slides, I apologize. I just finished them last night. So try to answer a few questions and get us going here. Who are we? What do I do? And basically, why are we here? And so what is AVORS? This is us at a dinner at some point. I'm not sure. Dr. Sherfey's big ugly face there in front. And we're celebrating. We are 9 physicians, a chiropractor, a nurse practitioner. You heard about everybody already from my administrators and my partners. Dr. Sherfey this morning. Again, the people that really help us keep going, there's about 100 of them, and they're all like minions running around the place, making sure everything gets done. We just get to show up and be doctors. We have Joseph, our CEO, Adam, our CFO, Yesenia, our COO, Gary Schaffner, who's not here today. He is the most amazing human being on earth. He brings us coffee and lunch. And then we really wouldn't, I wouldn't be up here right now if it wasn't for Midian, who helped me prepare my slides and make sure I was here on time. And these people really take care of us. We couldn't take care of you without them. So who are the physicians? I'm going to go through this quickly because Dr. Sherfey did it for me. These are our doctors. These are the years that they joined us, so you can see our level of gradual growth over time. We continue to grow. There continues to be a high demand. Last year I also put up a slide that showed the United States is short 180,000 physicians. It's incredibly difficult to recruit physicians to this area. We put a lot of energy and effort into it, and hopefully we can continue to accommodate the need in this community. This is all of us. About almost 2 years ago, the only person missing from this picture is Dr. Daniel. It's my birthday. We're at a Labor meeting together. This is the whole group. That was a fun night. Say that again? No, they lost that night. I was upset. They lost that night. They won last night, though. They're playing tonight at 5 o'clock. Not that I care. So this is our slogan. I probably messed up a bit. I came up with this 20 years ago when we started the practice, and I'll tell you a little joke. I was so excited. You guys know what VistaPrint is? I went to VistaPrint and I got all these business cards printed and all these little stickies that said Injury to Independence on it, and it was free. And I later found out that I misspelled independence. And I still have some of those from 20 years ago. It's really cool. So what is it? This is a philosophy. It's a culture that we kind of live by. It's the way that we practice. We try to begin with the end in mind. And it's more of a collaborative type picture. We believe that function is important. What you're doing in your daily life is important. We commonly say we treat people, not pictures, just because your MRI or X-ray has something on it doesn't mean that's really what we're going after. The most important thing is what comes out of your mouth and what you as patients tell us. That's the kind of culture that we have. We really like to be collaborative. We invited several of our colleagues and other physicians this morning so they could be part of this and you could meet them. Unfortunately, a lot of them couldn't make it. But we, instead of being competitive with other practices in town, we put an effort to be collaborative with them. We go out and meet with them. We share ideas. One of the things we tend to tell our patients is, if I can't fix this, I will help you find somebody who can. So we're very passionate about that, and our culture is something that we really hang our hat on. So what do? I'm one of the founding fathers of, I guess it makes me sound old, but I'm one of the founders of Dr. Antebi and I started the practice about 20 years ago. So in May We both graduated, so late spring, early summer. It's going to be 20 years, we're about 19 and a half years old now. And I represent the pain management side of the practice. I'm a pain and rehabilitation specialist. Again, my focus is on function. There's a good number of patients who end up getting joint replacements, and there's a lot more to your knee than your joint. There are soft tissues, there are nerves, and a lot of things that can continue to produce pain, and this is where we kind of take over in the practice, pain and function. So I want to go over some of these things that I do that I think are really special and that I'm really excited about. One of them is spinal cord stimulation. The spinal cord stimulator is a little device about the size of a silver dollar. It goes underneath your skin, and there are two wires that come out of it. Those wires go into your spinal column. They go over the back of your spinal cord with a dorsal part of the spinal cord. The back of your spinal cord is what controls sensation. Now what we are able to do with various waveforms is send an electrical signal through these wires. And that signal can sometimes, and oftentimes we find in the high 90 percentile rate, turn pain on or off like a light switch. It's incredibly effective for diabetic peripheral neuropathy. It's incredibly effective for limb pain, nerve pain, burning pain. I use it for a lot of things, and we've been very happy with it. We have a new technology now that allows us to program this device without you even coming into the office. So sometimes the initial programs don't work, and we are able to program this device and give you different programs without even having to come in. Excuse me. Something else that's great about this that I really like is if you're going to go get heart surgery, if you're going to get a hip replacement, if you're going to get something done, there's almost nothing in medicine that you can test before you're going to get it. So if you're an athlete and you have to have an ACL repair, I can't say this is what it's going to be like with your new ACL. This is what it's going to be like with your new knee. We have to hope that we're making the best decision. We can test this device to see exactly how it's going to work before you get it. And the test is minimally invasive. So this is what's really wonderful and makes me very excited about it, is that when I ultimately end up implanting one of these devices in a patient, I have so much confidence and assurance that it's going to work because the trial tells us gives us a lot of data about how effective it is. And so that's something I really like about spinal cord stimulation. Similarly to a spinal cord stimulator, this is actually a picture of one of the stimulators implanted. So similar to that is what's called a pain pump. So these were typically called morphine pumps back in the days. They've been around for a number of years. I used to not do these. I have begun doing many of them because they were coming into my office with complications that needed to be worked on. In the old days, before there was an opioid epidemic, and I'll just give you a quick idea. Okay? I graduated residency 20 years ago. When I was in residency, if a patient had pain and was taking pain medication, my teachers told me just give more. We just gave more and more and more, and it really, really got high. And no pun intended. And what would happen is patients would come in and they would be tolerant to these drugs. And when they were tolerant to the drugs weren't working. This company, Medtronic, invented this beautiful device that would enable us to give patients more drugs. And so that's why these pain pumps came around. And they ultimately started getting a very bad rap because people were getting more medication from these pain pumps. But let me explain to you a little bit about what they're done. Just like when you build a house, you have to use the proper tools. When you take care of a patient, you have to use the proper tools, and you have to use the tools properly. So when we use a pain pump, we are taking medication and directly delivering it into the spinal column over the nerves that are producing sensation. Typically it's used for back pain. However, I'm one of the few doctors who have used this for neck pain, and we can take this little catheter and thread it all the way up to the top of your spine and distribute the medication there. The type of medication we use and the type of dosing we use is variable. So I can change this pump, and I tell patients all the time, I can make it do pretty much almost what your alarm clock can do. I can have it give a dose at different times of the day, larger or smaller doses at different times of the day. The different types of medications we use will spread further or stay locally in the area of the tip of the catheter. It's brilliant until people misused it, and it can give you patients quite a bit more. So we have a protocol that we have created from scratch, my staff and I. It's a dosing protocol where we're able to reduce all of the oral opioid medications and deliver the medications through this pump. We give patients diaries. They come in, they tell us I'm having pain this time of day, that time of day, and we can program this little device to give them medication during their activities, during different times of the day, and reduce their spinal column over the spinal nerves. You're not exposing your entire body and all of your organs to the medication. So it's a very, very effective modality, and it's incredibly safer, and most people are not at the pharmacy every month picking up prescriptions, so they're a lot happier with it. So we really like this device a lot. I think I'm pretty sure I do more of them than anybody in the valley. This is a procedure called mild. If you look here, that is a piece of thickened ligament in the back of the spinal column. This is on normal level. That's a disc, and these are the bones. This is the spinal column, okay? You can see there how badly narrow it is. I'm left-handed, so what is my right hand is shaking? I use both hands now, Braver, I promise. And so you can see there, this bone here is working. That one is shifted forward on that bone, and there's a little picture there, but that's what I'm talking about, that big black blob. Now with this procedure, we make an incision about 1/2 centimeter. It's really more of a puncture with the blade instead of an incision. And we're able to take that piece out and open the spinal column. You can see here, I'm going to show you this because it's really worth seeing. If you look here, this is the space beforehand. So that's say 3.65 centimeters. And then you look afterwards, and it's like 14, that space there after we opened it up. And so that's what we're able to do. This is the spinal canal, this little circle here where the nerves are coming in. This is the foramen where the nerves are coming out. And this is the disc. These are your back muscles, just for reference. So look at how tiny that space is that's expected. Your spinal cord is expected to move to that tiny little space. And then look at how big it is afterwards. I don't know what you think, but that's impressive to me. To be able to do that through a 1/2 centimeter incision is really fantastic. Previously, people would get what's called like an open laminectomy, where you have a larger incision, you have to dissect down and do that. So, we brought this to the valley. We're the only ones in the pain management world doing this, and I've done this on my friends' families, and it's been very, very effective. People, walk out of the operating room feeling better immediately. And so this is me after doing 100 of them. This is a couple of years ago, and then this is something else that I do. This is called basivertebral nerve ablation. So you can see here on this slide. There it is, okay. So, again, this is the vertebral body. The space here is where the disc would be, okay? These little bright spots are called modic changes, and that's where we get what's called sclerosis. And the bone starts to wear away because the disc has worn away, and it gets hardened and painful. Typically, the patient who has this, injections won't work, and in the past what would happen, they would go in and they have surgery, and the surgeon would cut all of that out, put an artificial disc in, or put rods and screws to fuse that piece together so it would never move again. And what we do now is we do something called a nerve ablation, where we put a probe in, and we're able to burn the nerve that goes to those disc spaces so you don't feel them anymore, which has been very successful. Again, that's something we just brought to the valley. We're the only ones doing it. This is what it looks like in real life. We do it under x-ray, and you can see here, and I'll switch from side to side so I'm trying to keep you awake. There it is. And so this is the probe going in, and there's the disc space. You can see even on fluoroscopy it's blackened and hardened and irregular and painful, and that's what it looks like when we're burning that nerve. This is me after doing some crazy number of them. The only reason this slide is up is because my circulating OR nurse, Daisy, took these pictures and told me I had to put them in my presentation, and she didn't come today. So if you ever see her, you can say, Dr. Nasser, put your pictures in the presentation. And in this picture, which is really cool, I don't get to use a hammer a lot, okay? But the orthopedic surgeons get to use a hammer all the time. And there's a hammer. And I shouldn't tell you this, but in this procedure, I get to use a hammer. That's funny. So what comes next? This is what's really cool. So every year, I do this little talk, and I tell people what we're going to do next. And last year, I said we're going to do Intercept, and this year, I get to tell you about Intercept. So this is what we're doing next, and next year when you come, I get to tell you about how all these things are going. This is incredible. So there are 4 things up there. I'm going to talk about each one of them very briefly. One of them is PRP, protein-rich plasma. This is where we draw your blood, we spin it, and we can put that blood back inside to an inflamed joint, into a spinal segment, or something like that. It radically reduces inflammation. It's very natural. The other is stem cells. We harvest stem cells either from your adipose tissue or from your bone marrow, and that is a similar process to what we do with PRP. It's called regenerative medicine. And stem cells act as building blocks for new tissue and regrowth of healthy tissue and de-inflammation. The third thing up there is peptides. Peptides are absolutely amazing. These are signaling proteins. We have a peptide program that's proprietary to our practice. There's a lot of P's in that sentence. Anyways, we have a peptide program that's proprietary to our practice, and it's very, we do everything for the patient. It's a self-injection you do every day for 2 months. It works on de-inflammation, new tissue growth, and I currently am on this program myself. I have arthritis in both my knees and in my back, and if you look closely, I'm on day 19. I believe I'm taller. It feels like I'm taller. So it's worth trying. It's worth trying. Trust me. I think you'll be happy with it. The last thing up there is something called PNS, peripheral nerve stimulation. There is a percentage of people after joint replacements who continue to have pain, and there are peripheral nerves to the knees, to the hips, to other areas of the body. We are building a program under Dr. Scott Daniel of peripheral nerve stimulation, and that's something we hope to offer in this next year. So that's it, really. We're here to say thank you to you guys. We feel very, very blessed. We know as a group that we are part of people's lives in the most critical and challenging part of their lives, and we take that very seriously. We're very grateful and thankful that you guys could all come out today. I'm thankful to my partners and my administration team that we wouldn't be here without you guys, and please continue to come next year and bring your friends to us, because there are a lot of physicians in this community and in most communities. We are fortunate enough to own another organization that does actual management services. So we offer services to other practices. We've sort of taken our show on the road, so to speak. And we help these practices with their billing, with hiring physicians, with their purchasing and all those other things. And something that Dr. Sherfey and I have seen as we've pioneered this, and we've sat with seriously hundreds of doctors in the past several months and talked to them about their practice, is the landscape of the business of medicine is becoming increasingly challenging. Our colleagues are burned out. Our colleagues are exhausted. Taking care of human beings, especially those who are in pain, is incredibly difficult. And we feel blessed beyond measure to be enthusiastic and excited and still here and ready to do this. This is the best job in the world. It is so much fun. We have a great time together, and we love taking care of people. And so we're hoping that that culture that we have is contagious. It's contagious into the community, it's contagious to you guys, and it's contagious to the other physicians that we try to bring on board and work with us. So thank you so much for being part of that and being part of the AVORS family.